Hi, I'm Candace from Topcon Healthcare. Today I'm going to show you how to perform intraocular calculations for post-surgical eyes with the Aladdin. If a patient has previously had refractive surgery, such as LASIK or PRK, the alterations in corneal curvature can have a negative impact on IOL calculations. This is why the Aladdin provides several options for dealing with this issue. One set of options will be under the post-refractive IOL tab. Here, you can select the type of refractive surgery that was performed. You can select the correction type, that is myopic or hyperopic, as well as the type of surgery, such as LASIK, RK, or PRK. You can also select which formula you would like to use, the Camelin-Colosi or the Shamus No History. The Shamus formula can be used when you do not have access to information about the patient's previous refractive surgery. Note that this formula can be used only with LASIK, LASEK, RK, and PRK, though it can be used for both myopic and hyperopic versions of those surgeries. The Camelin-Colosi formula, on the other hand, can be used with more types of refractive surgeries, but requires you to know the surgically induced refraction correction, or SIRC, which is the diopter shift between the pre-surgical refraction's spherical equivalent and the stable post-surgical refraction's spherical equivalent. Once the choices are made, simply select Next. This will bring you to a new screen under the Post-Refractive IOL tab. It will look similar to your basic IOL calculation screen, except that the formula choices are limited to the ones you selected on the previous screen. Your other post-refractive options can be found under the Barrett tab using the True K option. On this screen, you can select the type of refractive surgery that was performed, the pre-surgical refraction as the spherical equivalent, and the stable post-surgical refraction as a spherical equivalent. Or you can select No History if you do not have this information. As we know, refractive surgeries do not always go as planned. If a patient still has an excessive amount of astigmatism, even after their refractive surgery, the Barrett tab also offers the True K toric option, which allows for calculating for a toric implant after a refractive surgery. You will need to enter both the refractive surgery information, as well as the information needed for the toric lens, that is, the amount of surgically induced astigmatism and the intended incision location. Finally, the Barrett tab also has the RX formula tab. This option can be used to calculate IOLs for eyes that already have an IOL implanted, should that eye either need to have the IOL replaced or a second IOL position in front of it. Depending on its intended use, this option can require several pieces of information, including the keratometry from before the original IOL implantation, information about the IOL that was implanted, and the stable refraction after the IOL implantation. The information needed can be found listed by selecting either the RX Piggyback IOL option or the RX Exchange IOL option. And that's how you perform calculations for post-surgical eyes with the Aladdin. For more information on configuring post-surgical IOL calculation default settings, please check out Topcon Healthcare University, and we will see you later.